A warm namaste to all of you and welcome on my board again, where we are discussing that what happens to a couple when they enter a fertility clinic. They are shooted with questions, they get aggressive as to why the doctor is asking them so many questions, the doctor shoots them with a lot of tests, but my dear friends, it is very important before the doctor gives you a final diagnosis and a plan of treatment. So how are you all doing? And we are here to put you into the details of why we are doing all these things. We discussed about age, we discussed about occupation, we discussed about coitus, we discussed about years of marriage. We also discussed about the medical history, which is important when we ask you as to is there any medical disorder what you are suffering from. So now the next step is the investigations. When you come to us, there are a lot of couples who most of the times have shown somewhere else and they already have some set of investigations with them. For others who are coming to us for the first time, they are trying on their own and they have not evaluated themselves anytime. So what are the tests, the first line of investigations, what we tell to a couple to do when they come to us for evaluation of a fertility problem? So for a female, the first set of tests which we tell her to do is a day 2 test profile. So now why do we do it on day 2 or 3 of menstrual cycle? We tell the female partner to get 3 to 4 tests which are very important for us strictly for second or third day of the menstrual cycle. They are FSH, LH, estrogen, which we also call as E2, progesterone, which we also call as P4, and AMH. So these 5 tests, they actually tell us about the fertility profile of a female partner. Again, we also tell a female partner that we would need your day 2 or 3 ultrasound. Most of the time, the female partner asks me that, ma'am, I'm having a menstrual bleed and how is it possible for me to get a second or a third day ultrasound on a day of menstrual cycle? But I want to emphasize over here that this ultrasound is strictly about the reproductive system, which tells us about your ovaries, your status of uterus, if you have any kind of pathologies in the uterus, the volume of the ovary, and the antral follicle count, which we also call as the AFC. When we evaluate your ovarian volume and we evaluate your antral follicle counts, we actually come to know that what is the reserve of eggs in your ovaries, and that helps us in the decision making to formulate a plan of treatment for you. Going further on your menstrual cycle, we would also tell you to go for a tube test if you have never evaluated your tubes. A couple is trying a normal conception and is not able to conceive for quite some time. So there are different set of parameters which have to be assessed in a female, in a male. When I talk about a female, I talk about ovaries, I talk about uterus, I talk about tubes, and I also talk about the cervix or the cervical canal, which is equally important to be assessed. So when I tell you to do these fertility markers of FSH, LH, E2, AMH and serum progesterone, I'm actually trying to see your ovarian age. Again, on day 8 or day 9 of the menstrual cycle, I would tell you to go for a tubal test, which actually tells me the patency of your tubes, whether your tubes are open or not. It is very important for us because if the tubes are open, we might help you conceive naturally through ovulation induction and through IUI if you are not able to conceive by trying normally. What is ovulation induction, how do we do it, and why do we do it will be discussed later on in my videos. As of now, that is a plan of treatment which we suggest when we evaluate you. Once we have a clear picture about your tubes, that your tubes are open, and now then we can think that whether we should recommend you an IUI or whether we should plan a timed intercourse cycle for you by forming an egg by means of ovulation induction. We also would like to see the status of your endometrium as to whether it is regular What is the thickness of your endometrium? Is your ovary forming a follicle on its own without any medication? Is that follicle getting ruptured? So we might also tell you to go for a natural cycle follicular monitoring scans in the cycle when you come to us for evaluation of your fertility. Now, what are follicular monitoring scans? These are transvaginal scans which we do for you from time to time on some respective days of the menstrual cycle, which actually tell us about your eggs, about your ovary, about your endometrial status, and which actually also helps us to decide the plan of action for you. If you have a good endometrium, if you have a follicle which is growing and maturing on its own, the follicle is getting ruptured on its own, it's so simple for us to understand that maybe the timeline of your coitus is not suitable, and that is why you're not able to conceive. If the egg is forming but is not getting ruptured, then the problem is different. If there is no formation of the egg, then you might have an ovulatory disorder. If there are issues with the endometrium but your egg is fine, it's rupturing, coitus is not a problem, then you might have endometrial issues. So all these issues might require different plans and different evaluation systems later on step by step. The first set which we would want to do is this. In the later part of the menstrual cycle, somewhere around day 20 or day 21, we would also like to again do a serum progesterone for you to understand whether you are ovulating or you're on your own or not. For husband, we would go for a simple semen analysis if the husband has never got it done, and this semen analysis has to be strictly after 3 to 5 days of abstinence to have a good picture to understand that whether the semen problem is there or what is the problem in the sperm. Count, motility, morphology, liquefaction, viscosity, timing of ejaculation, all these parameters. pH of the semen is very important. So a semen analysis gives us a lot of information. What is the significance of all these factors we would discuss in my later videos when we actually discuss the parameters of semen and what importance does a semen analysis have in a male's life and for us to plan and formulate a treatment. Thank you so much for hearing me, and I would like to educate you further on this as to what would be the next steps when you enter a fertility clinic. Yes, it requires a lot of time, it requires patience, but above all, it's worth for parenthood. Thank you so much. Keep in touch. Bye-bye.